Hello, everyone, and welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst. So in 2017, I launched Revitalize MD on a mission to help people find solutions to looking, feeling, and functioning better, solutions that traditional medicine just did not offer. And I am a traditionally trained MD that has a specialty in emergency medicine and practiced in the emergency room for 25 years as I started to notice myself changes in the way I was functioning, looking, feeling, and I wasn't alone. There were colleagues and coworkers and patients feeling the same way. And after all the workups were done, it was always the same answers. Everything looks good. Everything looks normal. I began my journey into anti-aging medicine approximately 10 years ago or over a decade ago. And that was because I was learning that there were solutions for looking and feeling and functioning better. And I wanted to bring those comprehensively to patients. And through the podcast, I'm hoping that we can reach more people and get the message out there. And so I have a couple guests today with me. And so, Meredith, do you want to introduce yourself?
Hi, I'm Meredith Wallace, and I've been at Revitalize MD for almost a year now, believe it or not. And I'm, a skincare specialist and laser technician. So we are going to be talking about a couple different things, mainly microneedling today, but I will go ahead
And I'm Samantha. I've been with Revitalize since almost the beginning, so like 2 years, and I'm excited to go over microneedling because a lot of people may not know what that does for your skin and how important it is. So,
all right. Well, and it's something you guys do as well, even as you're younger. So microneedling. I'm just going to let Meredith start to talk about it, and then I will, add in, as every once in a while. So,
Sure do.
So,
yeah.
All right.
We can kind of just have a discussion about kind of all the ins and outs of microneedling, and you guys can ask questions and comment on the things that you're interested in getting more details about, specifically with microneedling, that we may not answer. Obviously, we're kind of just touching the surface on all of the wonderful things that microneedling can do for your skin. There's really not any skin condition that can't be at least not necessarily cured, obviously, because there are some things that cannot be cured by microneedling, and a lot of different aesthetic procedures like rosacea and things like that are a little bit more difficult to cure per se. You can always make those things look a little bit better through microneedling, even lasers and things like that. But today, obviously, we're specifically kind of speaking on microneedling. So it's going to help regenerate the skin, help with collagen regeneration. So your skin is going to have cell turnover about every 25 to 28 days. So in that time period, if you can get underneath the skin surface and really try to dig some holes basically underneath the surface, it will help renew that, rejuvenate and renew that tissue to build stronger, more powerful, thicker, more fuller, lively skin. Microneedling is basically just trying to use needles to puncture the skin's surface in order to help regenerate. So it can do numerous different things. But most people get microneedling for the purpose of trying to have cell turnover and rejuvenate the skin. Collagen regeneration, which obviously as we age, we have so much less collagen over the age of 40 and 50 as we had in our 20s and 30s. That collagen depletes out of our bodies so quickly that the sooner you can get started with microneedling or things of that nature, the better that your skin will be able to kind of keep up with that cell turnover, and you will stay younger, looking longer because you're staying on top of it. Obviously, it helps tremendously. Even if you don't start doing it until your 50s or 60s, it's going to do wonders. But the earlier you can stay on top of it, the better off you're going to be long term, and the less often you'll have to do it, obviously. So pore size is another reason why we do microneedling. Scars is another big reason. Yeah. Acne.
Pigment, it helps pigment, and then even just texture.
Right.
Just
Hyperpigmentation.
smoothing everything out. And I always say that we lose 1% of collagen a year. So, again, the younger you are and the earlier you start, and, everybody's learning that now with all the social media out there. They have better ways to educate on microneedling and, treatments and services you can do at a younger age to get or prevent aging from happening, because skin aging is so important, and we lose 1% of collagen a year. So if you start at age 50 doing your first services, then you're really, 50% down at that point. So, but yeah, so do you talk a little, go ahead.
No, I was just going to say the two different options that we have for microneedling, one being skin pin, which is a little bit more superficial. Still, it goes up to 1 mil. Is it 1?
It goes up to 2.5, I believe, 2.5 millimeters under the surface.
Morpheus, which is an RF microneedling that can go up to 8 millimeters.
Well, on the body, but 4 millimeters on the face.
But up to 8 if you were choosing to do it in a different location. So what is the difference between RF and just regular microneedling?
Okay.
So you want to go into detail about what the radio frequency actually does and how much more beneficial it can be if you're able to tolerate the Morpheus over the skin pin, because it's a little bit more, it is a little more harsh. I would say it's
more intense for sure, because you're going deeper. And so basically when we're talking about skin pin, and there's different options, there's different microneedling devices, but that is a microneedling without energy. So you're talking about needles. And again, when we're talking about needles, that sounds scary. But even with that microneedling without energy, which is skin pin, for example, that's what we use, which is why we keep saying it, that you have to use a topical with, but it's not uncomfortable. But definitely a topical just helps numb the skin so that it's even more comfortable. Where radio frequency microneedling is actually where you're driving energy through the form of radio frequency into the skin and deeper. So you're blading underneath the skin, and so you're going to get better collagen and elastin formation, and you're going to stimulate that better with energy-driven microneedling. And again, age-related, like of course you can do all of the radio frequency microneedling at an earlier age, but when you guys are younger and you're preventing, skin pin microneedling without energy is fine. But I'd say at over 40, you really need to start thinking about radio frequency microneedling, because you're going to get better stimulation of collagen and elastin. We have greater loss. Again, we need some lift, which you're going to get better lift with the radio frequency than you do with the regular microneedling. You're going to get fuller nasolabial folds and dents and wrinkles that we have. So it helps with wrinkles, fine lines. And I always call those either scratches or dents, and it helps fill those out. Pigment, pore size, all the scars. Yeah. And then on the body, stretch marks. And so I think
also collagen production.
Yeah.
Is a huge thing with it too.
Yeah. So I think the big thing with the radio frequency, if you have more that you're treating, more severe, whatever it is. So if you think, if you're older, it's more severe lift, fine lines and wrinkles. But if you have a scar, then that's a little harder to treat with just regular. It still treats with regular microneedling. But if you think if it's a bigger, more treatments, so expectations and just discussing this, but also if you have a more intense scar, a bigger scar, or in an area that is more visible, and stretch marks are harder to treat. So I would definitely go with a radio-based device for microneedling with stretch marks. So.
Right. And I feel like with and correct me if I'm wrong on this, the Morpheus with a radio frequency, I feel like if you do have some scarring or things that have occurred because of a surgery or an accident, and you've kind of just let those go, and you haven't really done much therapy or massage work or doing anything to really stimulate the cells around the incision, then you're going to have a lot of scar tissue build up around that surface. So the radio frequency can help break down scar tissue as well. Or is that a little bit of a stretch?
No, it does, because it's going to help you remodel any of the collagen and elastin that you're forming.
Right.
And so it definitely helps not only in the scar, but around it. And again, I just think that the two are very effective for all the reasons that we discussed. So basically, if we're talking about pigment and pore size and fine lines and wrinkles and texture, scars, they all work, but you'll probably need more of them depending on what the severity of the scar is or the condition you're treating. And so radio frequency is just a little more intense, both discomfort-wise and results-wise. And again, we use topical numbing medicine, so it's pretty comfortable, but it's definitely more intense than the non-energy-based microneedling. And so again, we do have an additional agent that we can use, just to help with discomfort, which is Pronox, which is laughing gas. So sometimes we'll have patients come into the office and say they just want the laughing gas and not even a service. But so we might need to start just adding that one on, Samantha, as a little charge.
Check.
IV therapy and laughing gas. But anyhow, but so that's another option, for anybody that might be having discomfort, and that's a self-administered laughing gas in the office. But
also something else that we can add to the procedures to make them more effective is PRP. So if you want to touch on how well that works with recovery time, with skin pen, and also touch on how long the downtime is actually after these microneedling treatments, which it's usually not long at all. You're just red.
Yeah. So I'll talk a little bit about the PRP and then let Meredith go into all the downtime and what to expect after. And so PRP, if you haven't heard of it, and again, this is a podcast segment all in and of itself. So PRP we think is awesome. It's magical in what it can do, and we inject it lots of different places or even just apply it. So with microneedling, we're talking about applying it on the skin after. So what we do is we draw blood and then we spin the blood down to get the platelet-rich plasma part. And so what I explain to patients all the time is, say we have a cut on the arm and the platelets go to the area and stop the bleeding. So platelets are needed to clot that off and stop bleeding, but platelets also have growth factors in it. So basically heals, and you have arm tissue at the end of it all. You don't have scalp, you don't have, gum tissue, because there's stem cells inherent to an area. And so when we inject platelets, or when platelets go to an area to stop bleeding, they're communicating with the stem cells in that area to regrow tissue inherent to that area. And so we re-injected in multiple places to communicate with stem cells with the growth factors through the platelet-rich plasma. So when we take the blood, spin it down, we're getting the platelets, platelet concentrated form, which is platelet-rich plasma, and then we'll apply it with microneedling. And what we do is, again, you're doing the service, the device, whether it's skin pen or a non-energy device or an energy device, and then you're going to apply it over the top after. And so what happens is you have all those micro holes that you've formed in the skin. They're micro injuries, really. And with that alone, you're telling the skin that it's been injured and to stimulate repair and collagen and elastin, because it's going to heal just with those micro injuries. But then if you now have the micro injuries and you throw a bunch of growth factors in there, then you're going to get better collagen, elastin stimulation and better healing. But again, better or lesser downtimes too. And so I'll let Meredith talk a little bit more about the downtimes with the procedures.
The PRP seems to, especially with the Morpheus and microneedling, skin pen, what we use, you are going to have some uneven texture spots, some texture and things that are going to be present on your face post treatment that aren't as aesthetically pleasing as you would hope directly post procedure. And that all goes to the recovery and how long it's going to take for each person, because everybody is a little bit different when it comes to the treatments and how reactive they are. But some people just have a lot more streaks and lines and battle wounds per se in any kind of treatment that we do than others. So the PRP is going to help reduce that tremendously. And typically people can kind of walk out of there not really looking like they had a treatment done. I would say there's about a 50% difference in those that don't do the PRP versus the people that do. It's a drastic difference in just the healing time, recovery, and sensitivity too. You kind of feel like your face has been punctured, and it kind of feels like a sunburn and all of those things. Again, everybody has reaction differences from different skin types. But recovery and downtime specifically with that, I would say we always tell people, of course, don't ever have a treatment done and go home and try to put makeup on your face, because then you're adding parabens, different types of fragrances, all sorts of different things to that are going to damage the treatment that you've just done. And then you're getting all of those things. All those things are being driven down into the skin that you've just kind of tried to damage in order to have better collagen, elastin rebuild. I always like to tell people, try not to exercise, try not to sweat for about 3 days post-treatment. But if you wanted to the next day lightly do some light exercise, not necessarily like go into a sauna, specifically try to sweat. That could be a little bit more dangerous just from a bacterial aspect. But all in all, really the next day you can kind of go back to your normal regimen. We provide a lot of different things like the ASAP, silver bodic gel and things like that help kill bacteria, help heal faster, all of those things. Lots of different options in and out of office that we can provide to help make that a little bit more soothing. The SkinCeuticals, biocellulose masks that we have for all different sorts of procedures and things that we do. Those are amazing, can be reused if done properly. So lots of different options. But
being red for, because you do sometimes have to plan for skin pin. Because
right, absolutely.
You're going to be red for 3 days after. If that is a problem or an issue for some people, we do sell Oxygenetics, which is probably the only makeup you should ever put on after a treatment, because it's breathable. It's meant for that. So that is always an option too. If you can't set 3 days where you can't be red, there's Oxygenetics.
Right. You don't want to wear makeup. Or if you do, like she said,
make sure it's
not going to be,
it's
not going to have the parabens. It's not going to have fragrance, all those things that are,
going to go into those microchannels.
Right. It's just kind of crazy to just, automatically throw all of that onto a post-procedure situation. But it's not, some people are not even red the very next day. So again, it totally depends on your skin type and also what you've done in the past. If this is your first, you did a Morpheus and it's your very first treatment that you've ever done, you've not gotten chemical peels, you've not gotten dermaplaning, you've not done all those other things, it's going to be a true shock to the system, and you're probably going to have a little bit more response to that the first time. And I'd say maybe potentially be red for 3 to 4 days.
So I think it makes a huge difference. And you guys already touched on this, about a 50% decrease in healing time and redness just with PRP. So it's well worth it. I mean, I think that a lot of patients already come in wanting it, so they get that PRP works. Not only are you going to get better results by throwing all those growth factors into the microchannels of injury, but you're going to have decreased redness probably by the next day for the most part. Like you'll still be red that night, but a lot of patients are not red the next day. And again, you really want to be careful what you put on your skin anyhow, because of all the toxicities and products. So you want to make sure that you're using something that not only does something. And again, while you're getting these procedures done, the staff will talk to you about all the different skincare products you can use. And you want to put something that's not toxic on your skin. But what can happen if you put it on too early and those microchannels are not closed is you can get little granulomas or swelling underneath that is hard to get rid of. Because just think, if you had the wrong product and it gets in the microchannels and then those channels close, which they close pretty quickly, which is why we put PRP on right after. We will, if you have extra, give you more to take home, but we really recommend nothing but the PRP a lot of times. And you'll feel dry and tight, and your skin will feel that way, but go home. So definitely don't plan for anything that evening. A lot of people don't have time for downtime, and again, I think the younger you are, the better your skin looks anyhow. And so they're less likely to want to or need to have makeup on. But I'll just say from my age or for older patients, a lot of times they want to put something on the next day because they're used to it. But Oxygenetics is a fabulous product that does allow your skin to breathe. And the only thing that really that I'll ever recommend and is approved for a post-procedure that allows your skin to still breathe. And just a small amount covers any redness you might have.
And I feel like too, like the old, like the people that are over 30, I feel like they don't mind as much not going without makeup as much as the 20 and early 30-year-olds do. It's just what they do. They're not confident. They don't have the years of, just like, okay, well, I'm doing this to look better, to feel better. And it's like, I can go 2 days without makeup. I can do it. But again, everybody, do we have like 6, 7 different colors?
Yeah.
I don't remember how many shades, but
so just
pretty much.
Yeah, you can match it to your skin, tone and color. And so it's like a blue and a yellow kind of base. And so whichever one works for you, and we can test it out in the office, even on your hand. But I will just say that's how I got addicted to Oxygenetics, is that way back doing post-procedure, doing a microneedling was the only thing that you could put on your skin. I tried it and I've been using it ever since. So I'll either use a tinted moisturizer, with sunscreen or Oxygenetics with it, just because it covers with just a drop. And so the coverage is awesome. It covers any redness. I will say that with Morpheus microneedling, the energy-based device, sometimes you'll have a little bit more in the way of, not necessarily, I wouldn't say downtime, but you'll have maybe some scrapes, maybe some swelling after, and it's more of an allergic reaction. Not that it's been scraped when you have it, but we're stamping. So we're basically not just using needles that are gliding over, but we're actually have a stamp, and it's a square stamp. And so when we're doing that, we're lifting up and placing it elsewhere. But some people will have a little reaction to the outside of the square and the stamp. And so they'll either look like little scratches or they'll have swelling.
Right.
And so again, you just need to get in touch with your provider or our office if that happens. It's a very simple thing. Sometimes some steroid, like a 40 milligram of prednisone might help bring that down. But again, Oxygenetics covers all that, and you just got to know that it can happen. That's a normal process. Less likely with SkinPen or non-energy based devices.
Right. Yeah,
and so again, one of the other things that I always bring up with the girls in the office, who are all younger than me, is that they need to do the neck and the décolleté. So, when you're in with, your service provider, whoever it is, and definitely in our office, and our office will probably bring it up with you, because I even see them come out of the room after a microneedling, and it's redness that stops at the jawline. And so with that, I know they didn't go into their neck and chest. And I just say, you're going to regret that move when you're my age and your face looks awesome and your neck and your chest are more
she
wrinkled
reminds
up.
us every day.
Yeah.
Your neck and chest is going to look awful.
Yeah. And
you're doing all this to your face.
Yeah. There is no reason to stop. So you need to add those on. So definitely talk to your service provider about adding a neck and a chest. So the neck ages. People, and we're not talking about just women. I mean, men too get these frequently. And so it ages women though, and they don't like that. And then the décolleté or the chest area is another area that ages women. So definitely, even when you're in the 20s and 30s and getting these procedures, just have them do it. There's no reason not to include those areas in your treatment.
And I also notice too, especially with guys, but it's with women too, like right in front of the ears where we get really kind of wrinkled here. So I always try to get like right behind the ear as well, because it kind of helps lift and elevate that area to smooth out those lines just right around the ear. Or if you have short hair or you pull your hair back frequently, those are easily noticed. But it's kind of funny just talking about the scenario with the neck and the chest, because she always brings it up. Like after the fact, you kind of look at celebrities, you look at everybody, and I always do it now, is I'll look at their face and I'm like, wow, they take really good care of their face, or she's had a facelift, or she does laser or microneedling on a monthly basis. You can tell, but then you look below the chin, you're like, no, she looks 60. Her face looks 40. And her neck and her chest looks 60, just because a lot of, like, if they can't physically, they're just not looking at it in the mirror. They feel like, well, if my face looks great, then
I think
whatever.
it's actually just because they only went to the jawline until they were 50.
Right.
Just remember
maybe
that,
they
girls.
started right. Maybe they started now, but
Chest
too late.
Chest and neck. So actually, one of the reasons why I bought the Fotona is the resurfacing capability of Fotona at necks, even, and just getting a little bit deeper into those dented, not scratched areas. But the neck is one of them, and it has a great resurfacing. And it's because I saw, actually, when I was in Vegas at the conference, not really even thinking about what laser, but watching the TV, and I won't mention what newscaster, but very famous one at the time, who, again, skin on the face looked awesome. And then neck aged her for sure. And so we so frequently do it. And then it just happened after that I found Fotona, which does a great resurfacing. So anyhow,
and it's easier. I feel like it's also easier to treat, and you're going to have great success with treating that area because it is thinner skin and you don't have to necessarily go as thick. It will be a little bit more tender. You don't have to go as deep, but you're going to get great results quickly because it is thinner and typically does have a little bit more damage. And people don't put sunscreen on their necks and chests as much because they like having color here. They just like the whole package. So it would be great if more people.
I still can't understand why somebody would stop at the jaw purposely. Meaning so that I think I know
time management
because everything you just said, just
Rachel
again,
and Marissa, bail on you.
Because everything you just said, basically, again, we don't put sunscreen. It still has exposure. It does ages eventually, and it's only because we have not done anything with it up to this point. So if your service provider does not offer it up, you need to add on the neck and the décolleté or chest area to that service.
Right.
So that
typically if you get a service, it's going to be a lot cheaper to bundle them together and just go ahead and do it as an add-on, or sometimes we may even be running specials and do the neck or the chest for free. Mm-hmm. So there's always opportunities for that to be available because it is necessary.
And you can actually even add the hands, which is the other area that does age women as they get older.
I'm gonna start wearing turtlenecks and gloves to work every day.
As anyone, late 40s, definitely over 50, the neck, the décolleté, upper chest, and the hands are going to age them. And I don't think there's a woman that's over 50 that wouldn't agree with that. And so again, just addressing those areas when you're there, add them on. Again, if you're spending a certain amount for microneedling, adding those areas on is a lot cheaper and definitely going to address. And that has, hands have huge sun exposure. So they're always out.
You need to put sunscreen on. That's how when you're driving your car.
Everything. Your
exposed.
hands, your face, your neck, and your chest are the most exposed than anything.
Retinol on my hands.
Really?
Yeah, once a week, just because I can already tell that they're starting to get wrinkles. Because when you're driving, they're always in the sun.
Just because I'm always talking about it.
I get paranoid, self-conscious about my
always talking about it. So, but I think, the big areas of aging for women as they get older is, we've addressed the face, but is neck, chest, and hands. So definitely every treatment, even a peel, you can have a peel to your, to your neck and chest. So just think about that. Make sure that you ask, provider, if your provider doesn't bring it up with you. And definitely,
we can definitely do it to the upper back as well, where a lot of people in the summertime, they have huge exposure to that area too because of all of the strappy tank tops and
shoulders
and
acne scarring back there, where lots of people like to itch and pick and things like that. It can really help smooth out the texture of that. Chemical peels, microneedling. We can do Morpheus in that area, right?
Yeah. And then, so we already spoke then of those areas to add on. And then the other thing that I highly recommend is, again, PRP. So I would add that on every time because you're just basically getting a microneedling and boosting any of the results you get and decreasing your downtime. So it's well worth it. And so, look also if price is an issue with that, look for specials when they add PRP on, because we'll frequently add as an add-on to a procedure. So
this month, actually.
Yeah, that's
Now.
correct. Yep.
Now.
So then anything else downtime wise, prep beforehand? What about retinols beforehand?
Prep beforehand is important. I feel like we try to encourage people at least 10 days, if they can, prior to a microneedling. We would say come off of retinols and any AHA. I believe those are the only two major acids or retinols that we try to avoid. And obviously, if you have used Accutane, or it needs to at least be 6 months since your last Accutane to a year. That would probably be the highest recommendation. So,
and then post, again, we talked about if you're doing PRP, just don't do anything else. Do the PRP until the next day. And then you can start again, definitely within 2 or 3 days, resuming
doing what
usual
you're comfortable
skincare.
with. Right.
And then your service provider will definitely talk about what to do, starting the next day. And then see if Ferulic is something that we'll frequently use after too, and just think your products are going to get a little bit deeper and penetrate better over the next couple days. So maybe just not getting back to your usual skincare routine, especially with retinols, until that period of time is over is best. And sunscreen, of course, sunscreen with everything.
Kit, so that's always a great product.
Right. That comes with
Also on sale.
Yeah, everything that's in the post-procedure kit is coming together is going to be much more cost efficient than buying each piece by piece thing that you need, because you'll start using 1 or 2 out of the post-procedure kit and then realize, oh, I would really like to just add this, but I've already spent the total cost of the kit. So again, the kit is a much better deal.
Likewise, I think if you just think nothing is ever a one and done. And so you always need to look to be doing something probably every 4 to 6 weeks. So if you're doing a peel or microneedling or a hydrofacial, it could be simple things. And so those are things, even light stem therapy, something that is helping your skin. But with microneedling, again, when you're first time in doing it, you should really do a series of 3. So maybe separated by a month with each of them, or 4 to 6 weeks. And so look for that too, because it's usually cheaper in a series. And then maintenance of, at least that once a year. But again, doing something every 4 to 6 weeks with, that helps your skin turn over in a healthier fashion. Anything else you guys can think of?
So we don't really, and lots of people, are you going to get great results the first time? Yes. Are you going to love it? Yes. But everybody kind of, likes to think, well, if I just do it once, then it's better than nothing. And absolutely, it's better than nothing, but you're going to continue to age. And the collagen is going to continue to disintegrate the older that we get. So the more frequently you can do it, the better off. But again, the cell turnover is every 4 weeks or so. So doing it every 4 to 6 is definitely going to be ideal.
And even if it's a peel, again, or a light stem, or a, even another laser, anything like that. And there's, red carpet peels and hydrofacial again. So all those things help. So again, if you have anything else that you would like us to address, or any questions you have about the microneedling, that we talked about, then please either send us that or put it in the comments, subscribe, and share this with friends. And then
you can call or text the office to schedule a consultation with Meredith or Dr. Durst if you wanted to go into more detail about what all treatments we have in microneedling.
Or what's better for you. Yeah.
And other than that,
we have a wonderful staff that will definitely educate you along your journey, any of the services that you get done. So yeah, again, just drop us some comments if there's something else you would like us to discuss. And again, we're here to revitalize your look, your health, and your sex life. Thank you.